Hi, this is Patty Hodge at Dr. Nurses Rock. Today, I have a very special guest for you, Dr. Sherry Schachter, retired as the Executive Director Emerita in Bereavement Services for Calvary Hospital Hospice. Before her work at Calvary Hospital, Dr. Schachter was at Memorial Sloan Kettering Center, where she held many positions, including nurse manager, psychiatry fellow, and assistant attending grief therapist. Dr. Schachter is a recipient of numerous prestigious awards and for over 40 years has worked with dying patients and their family caregivers. In addition, she is the past president of ADEC, the Association for Death Education and Counseling, and a member of the International Work Group on Death, Dying, and Bereavement. Dr. Schachter is the mother of five and the grandmother of 10. She's an avid quilter who does all her quilting by hand, and I am so honored that she has agreed to come and talk to us today. I found Dr. Schachter looking for information about how widows handle grief, and she was so gracious to come and talk to us about that.
My pleasure. My pleasure, Patty. So please call me Sherry.
I will. Thank you, Sherry.
So let me start by just briefly telling you about the National Widowers Organization. So it's quite unique. In 2008, the founder, his name was Sam Feldman, and his wife of 53 years, Gretchen, had died, and he was devastated. And he went looking for support for groups. And he ended up in a spousal bereavement group, but he found he was the only man with about 8 or 9 women. And that was not comfortable for him. So he and Gretchen had a home in Massachusetts on Martha's Vineyard. And he sought out widowers in the community and asked if they wanted to come over and do an informal group. And so they started doing weekly groups, men on the island who had been widowed, and they would change houses each week. And from that, Sam decided this would be a good nonprofit to try and help other men who were grieving and who did not feel comfortable grieving in a mixed or gender group, would feel more comfortable with men. And so they incorporated. I joined National Widowers, I believe it was in 2011 or something like that, as a board member and as a clinician and a board member. And that's how it started. And it has grown. It's incredible. We now have a weekly newsletter anyone can sign up for. Just go on our website. We have online groups. We have resources, bibliotherapy, which I'll talk about later, as a tool to use. And all of our services are free. And it's so gratifying for me as retiring from the hospitals, over 40 years of working at Sloan Kettering and Calvary, to now be able to devote. I've always loved doing men's groups. I've done men's groups in the past. Calvary still continues to have an all men's group. But it's very gratifying for me. So that's just a little history of the NWO.
That's a beautiful story and such a gift to the world, because I have personal experience of being with someone who has lost his wife, and I see that there is such a couple of men that I know very closely, and it's such a painful thing to watch them grieve, and to know that they may feel like outsiders when it comes to going to these groups. So that this founder did a really remarkable, wonderful healing thing years
Yeah.
ago.
Yeah.
So tell us about how men grieve.
I think you need to have an understanding in the beginning that we all grieve And our grief is very unique. It's not just related to gender issues, which is
Yes.
part of it, but our grief relates to the relationship we had with the person, whether we were close, not close, enmeshed, ambivalent, whatever that relationship was. We have to consider our own beliefs, our religious beliefs, if that's a source of support or strength for us. We look at how we've coped with difficulties in the past, because the way we've coped in the past is the way we're going to cope now. And we'll talk more about how that shifts and changes. So we look at our experiences in the past with death. I always felt, I guess, protective and also worried about adult grievers who were younger in age, who have not had an experience with someone close dying, because they don't know that they can live through this. And many times people will say, this grief is so heavy, it's so intense, I'm never going to survive it. But someone who's lost a parent or a grandparent or close individual years ago has a different understanding, because they know they'll get through it. They survived it. They were able to
Yes.
survive it. So at the time, I used to worry about my daughters-in-law who hadn't had any losses at that time. And I kept thinking, oh my gosh, this is going to be so difficult for them for the first one. So all of those things come into play in how we grieve. Then about 10, 15 years ago, two colleagues of mine, Ken Doka and Terry Martin, started thinking about gender differences. There's always been huge controversies. Do men grieve? Do they grieve differently? How do you treat one and not the other? What are some of the tricks of the trade to help them? It's always been controversial. And they came up with a description. It's called intuitive and instrumental grievers. So an intuitive griever, we tend to think of as women, but keep in mind, men can be intuitive as well as women. But an intuitive griever tends to be someone who's open with their emotions. What you see is what you get. So when you're working with a widow, her eyes are red, they're puffy from crying, her nose is all sore from Kleenex that's not soft enough. I only use one particular brand in all my groups because it's the softest. It's very hard.
Yeah.
Crying is hard, and you see it on their faces. So what you see on the outside is what they feel on the inside. They're talkative, they cry, they share their emotions. Instrumental grievers are more cognitive grievers. So we tend to think of them more as men. And it's interesting because you can have a blend of the two different types. You can change, not necessarily wanting to change, but through experience, and we'll talk about that in a second, how that can change. So there can be a blend, and it's also on a continuum. So, for example, one example that they actually use in their book was a man whose teenage daughter or young adult daughter was killed in a car accident. And she went into a neighbor's fence, destroyed the fence. And immediately after the funeral, her father went out and bought lumber from the lumberyard and started fixing the fence. The owner of the property, who's not a direct neighbor, but a couple of houses down, came out and said, you don't have to do this. I have insurance. The insurance will take care of the fence. You don't have to worry about the fence. And the father said, you don't understand. It's the only thing I can do. It's something I can do, right?
Yeah.
So it's to me, that's just a perfect example of an instrumental griever. and how they function. I will share with you that my grieving style changed personally. I was always a very instrumental griever, maybe because of the work that I've done with dying patients all these years, but I've always been logical and cognitive and problem solving. And that was my style to the world to express my grief. After 9/11, I worked down there from September 11th until the second week in January when I couldn't do it anymore. I went every single night except the weekends. I went every weekday night after work. And by January, the second week, I couldn't do it anymore. But I also found my grieving style changed. No longer instrumental. I could cry at the drop of a hat.
Yeah.
You know, I still have not been down to 9/11 since the towers went down. And I live in New York. So it's not a question of me getting there. I'm finished.
I can relate to that for sure.
So it's interesting how these changes come about. It's also interesting why women do so well in groups, because they're okay to cry. They actually, it's a release for them to cry.
Yes.
They want to tell their story, and they repeatedly tell their story. By week 3, I know everyone in the group story, and I can tell it in their words because they tend to repeat over and over and over again. That's very different from instrumental grievers. Instrumental grievers don't like attending groups. They don't want to talk about their feelings. When I'm working with a widower, I never ask him, how did you feel after your wife died? Partner. When I say wife, it's wife or partner. And I never say that. I say, what did you do after your wife died? And they go right into mode. I did this, I did this. I went back to work 3 days later. I did, very, very different from women. And although they may cry, certainly they may cry when they're alone. They sometimes cry in the men's group too, but they don't repeatedly tell the story over and over and over again. They look at themes, loneliness, huge theme. So they look at themes and they discuss that, but it's more problem solving, more intellectual and cognitive. And that's why we don't call our men's group a men's bereavement group. We call it a men's discussion group. Because the name itself is inviting. If you say a bereavement group, I don't need a bereavement group. I'm a man in the family. I don't need a bereavement group. So it's very, very different.
Yes.
But again, I caution people to realize that there are women that grieve in an instrumental style and men in a more of a feminine, intuitive style. And that doesn't mean they're not grieving. Years ago, when I first started that, clinicians really believed that men were not grieving because they didn't look the same as women who were grieving. And so the belief was they're strong and they don't need to grieve. They're not grieving. So attention really wasn't given to men until really people started questioning, well, that doesn't make sense that men don't grieve. Of course they grieve. They just grieve differently.
Yes.
Differently. The other thing, men in particular talk about loneliness. Women do too, because I've done mixed groups as well. And as Sam, our founder, found out, most of the groups are all women. They talk about loneliness too, but it's different because women tend to be more social. They have girlfriends. They talk on the phone. They make the Saturday night arrangements, who we're going to have dinner with and what restaurant we're going to, or what movie we're going to see. They usually are the ones that make the arrangements for the couples. So when the wife dies, the man is really left without that support system.
Sure.
Now, they may initially call and say, come with us, we'll go out, the 3 of us will go out. But chances are after a while, and after men say, no, 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 I'm not ready, they tend to stop. So loneliness is a huge issue for both, but I think men have a more difficult time because they have friends, they have acquaintances, they have golfing buddies or people they watch football with or go to the Yankee game with. Not the same, different kind of a relationship than most women have with their friends. So the loneliness is a big factor. It's also, it's interesting. One of my clients, we talk about roles in the family, and we all have roles. This one takes out, does the laundry. This one does carpooling. We do food shopping together. This one does finances, even who takes out the garbage. We all have roles in the family. Well, whoever is surviving, whatever spouse is surviving, they now have all the roles. And that is very daunting. I think men have a more challenging time, again, because of the isolation and the loneliness, and because they're not used to doing a lot of the things that women do. Now, you could say many men do the finances, and so women are not familiar with that role. But that's a lot easier. I'm married 63 years, and every year I tell our accountant the same thing. If my husband dies before me, I'm coming in with a shoebox. I don't do taxes, and I don't want to learn how to do taxes. But I know who can do them, who's been doing them for, all these years. It's very different. One of the roles that I think is very interesting and different is I had a husband say to me, his wife was the buffer between he and his daughter in particular, but he and his children. And by that she meant, and she would tell him, now when you get on the phone, don't start preaching to her. Don't tell her what she has to do. Just listen to her, just validate what she's going through and leave it at that. So when his wife died, she was the buffer. She would say, don't do this, don't say this. This is a better way to say something you want to share with her. And he had to learn, because he loved his daughter. He wanted to learn how to learn to be a buffer himself so that he could communicate with her. And I thought that was such a perfect, again, cognitive, very thought, problem solving. This is what I have to do. Another daunting for widows, both small and young. For young widowers rather, having to raise children is a major component, major component, because most men, unless they've been stay-at-home moms, they're out working. Now they have to figure out carpooling, and they have to figure out how do you make lunch in the morning? What do you make it the night before? What do you put in their lunchbox? School homework, a myriad of things. How to braid their daughter's hair, if it's a little girl, how to have the dreaded sex talk with teenagers. Issues are very different. Issues are different for younger widows as they are for older. And when I say younger and older, I really, as it relates to children, because older children have their own complications. That could be a whole topic unto itself. When the individual starts wanting to look for companionship and want to start dating, often it's the older children that become problematic in that new relationship. Who's going to, what about the money? And even if it's not about the money, she's going to be in my mother's kitchen. She's going to be using my mother's dishes to cook, so it becomes, the other thing I want to jump back, I neglected to say with young children, young bereaved children need structure and they need consistency. And that's as the role of a supporter, whether you're a clinician or a family member or a neighbor or a friend, is really important to be able to gently, not lecturing, but gently explain to the widower, the young widower, why it's important. He may think because the child is not crying all the time and playing, they're not grieving, they're too young to understand. Even an infant who can't understand what, obviously, what happened, knows someone is missing from their life.
Yes.
And so age age is important as it relates to developmental steps for children. Again, that's a topic unto itself, too much to go into today, but important because that gives the young widower information on how to react to his young children, because they're very self-centered. Well, who's going to take care of me now? What do I do after school?
Yes.
What house do I go to? Who's going to pick me up from school if that was her role, picking up the children from school? So the issues are so different for men and women and older and younger. One other thing I want to say on this topic of men and women
Yes.
is I worked with a individual who is a very famous author, published author. And when his wife died, his adult children were calling him several times a day to talk to him, giving him advice, what to do with what and when to do with mom's clothing, what to do about selling the house or the apartment. He had owned his apartment. What to do about selling the apartment, what to do about his stock portfolio, all these things. This was not a cognitively impaired individual we're talking about. It was a highly functional man who said his next book is going to be, What Shall We Do with Father?
Yeah. Well, they were grieving in their own way,
Yeah.
wanting to take charge somehow. You're offering such wonderful information for us, and uh, I want to make sure that we cover as many topics as we possibly can. We do have limited time, obviously, today. So I'm hoping you'll come back and talk about different aspects of this, because you've now become my official expert on grieving. Um, for all kinds of people and cases. But let me see, is there anything that we should address in the few minutes that we have going left here? Um, the coping strategies you've talked about, really how they the difference in the two types of grievers.
Right.
And that was really struck home with me, because I remember so many men in my life just getting up and doing something and wondering what the heck they were doing when, we just had this big thing happen.
Yeah.
And now I get it. And being a nurse, I've experienced many losses. Obviously, I've been with many dying people over the years. And um, I also have changed my grief process over time, so I can identify with so much of what you've said today. So the best way to support a grieving person is, obviously it might be different for every person, but is there in general
Mhm.
something that we can say or not say or do?
Exactly. So I think the most important um, is to recognize telling an individual, a bereaved individual, call me if you need anything. That's a no-no. That's like saying, come for dinner anytime. And then at 7 o'clock on a Saturday, you get a knock on the door and someone's there. It's like an open invitation.
Yeah.
Oh, it's not helpful to say, call me anytime. I'll do anything. Call me anytime. It's much better to tell, especially an instrumental griever, I'll pick up the kids tomorrow from school. Um, I'll go food shopping for you. I'll go pick up the newspapers for you. I'll go to the cleaners. Concrete things that you will and can do for them. That is so important. A blanket, anything, just call me. Anything you need, just call me. That's not helpful. You need to be specific and then follow through.
Okay.
Most of us, when we do something to help someone else, we feel good about ourselves in addition to helping them.
Sure.
Makes us feel good. It makes us feel useful. So that's really important. Just being present to with the individual. You don't have the answers. Clinicians don't have the answers. There are no answers. Hopefully, if you are a religious person and you believe in an afterlife, maybe you'll get answers then. But there are no answers. But listening is important because by listening, you're validating to them what they're going through and that you're able to tolerate it. Sometimes I will say to someone, there's nothing you can say that's going to make me go away. Nothing you can say that's going to damage me.
Okay.
Really, I mean, I've heard it all. I mean, I don't tell them that bad at the time, but I have heard many secrets that have come out after a death. Some came out as soon as I paid a condolence call to someone. And during this period of shiver, during this condolence period, she found out her husband was not faithful to her.
Oh dear.
From a neighbor who thought she already knew it. Happened 20 years ago. Now, I knew it because her husband had told me before he died. But so it's really just listening. You could zip up the mouth. You don't have to say anything. Just listen attentively and show that you care that way, which is extremely important. Sometimes what happens, especially initially, a widower, often it's more times the widower than a widow, widower will get calls from friends or neighbors, let's do something, come for dinner, trying to get them out of the house. And they often say, no, I'm not ready, I don't want to. And so people stop calling. And then several months later, when the widower is ready to go out, no one's calling. So it's important to keep in touch with the individual. You don't have to hound them every week, but it's important to be in touch. So when they are ready, because most likely they're not going to reach out to you.
Yes.
An intuitive griever will reach out to you, not an instrumental. They're going to be busy at work and trying to manage their daily activities. So I think that really is the most important points about how we can, there are other things that we should say and not say, like I caution people, this wonderful little book, I think it's out of print now. It says, I know just how you feel. And it's all the things you shouldn't say. Saying I know just how you feel does not validate someone's grief.
Right.
Because even if you've lost a spouse, we're all different. Again, because of religion and community and experiences and social supports, all of those things, as well as the gender differences, all of those things influence how we grieve. And so no one's grief is the same. And you don't know how someone else, maybe they're angry. Maybe they found out some of the secrets that were hidden. It's
Yes.
not so unusual. It's unusual for them. But as a therapist, I can tell you, many marriages have many, many secrets that don't come out, both to the surviving spouse and to adult children as well. So again, that's a whole other topic for another time. But telling someone I know just how you feel, no. Grief is like a cut finger. We all have fingerprints, but our fingerprints are different. And like that, it's the same thing with a cut finger. It's different for everyone. You don't want to give unsolicited advice. Even if they ask you and think, although probably with instrumental grievers, they will tend to ask you more advice, but I guess it's pretty much the same for widows as well as widowers. I would not offer unsolicited advice at all. Saying again, I know how you feel, not a good one. Another one, not so good, is she's in a better place.
Oh,
Ah, she's not in a better place. A better place would be here with her children and me.
exactly. Yeah.
That's a better place.
Yes.
No, she's not in a better place. That's the worst. Oh, God. Oh, I know how you feel. My dog just died.
Oh,
Now, I am a pet person. We've always had pets. I loved my pets. I mourned and grieved for them
yeah.
terribly when they died or I had to put them down. It was terrible, terrible. It is not the same as losing a spouse. It's not the same. Um, so I think those are the probably another bad advice to say, especially for a young widower, although older widowers too, is oh, you'll find someone again. You'll get
Mm.
married, especially young. You'll get married, you'll find someone again. You're young. Well, that may or may not be true, but that certainly is nothing anyone wants to hear in the early phases of grief, that they're going to get married again when they're still devastated. So I can't tell you how often that is. I had a guy, a young widower who was in his late 30s and his wife died, no children. And all his friends, oh, you'll get married again. Come on, let me introduce you to so and so. No, 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 he wasn't ready. He wasn't ready. Months later, he met someone, not on a dating app or anything like that, but can't remember whether it was at work or someone had introduced him to this woman, and he brought her on a date to meet other couples, his friends. And afterwards, he got such flack from them. How could you be dating already? It's not even a year. And so mixed messages,
Yes.
not a thing to say. Not a thing to say.
Well, you've certainly you've covered so much ground here, and there's still so much more to cover. Um, I mean, everything you've said starts another set of questions in my mind, and so we do have to come back again and discuss more about the different aspects of grief that people just don't understand or pay attention to. And the one thing that I do know is that everyone has grieved or will grieve at some point in their life, and that we need to be prepared to understand that a response we get from someone may not be coming from a person that's free of pain at any given moment, you know. And so if we have compassion for one another, if we're open to understanding that we may be addressing someone who's grieving at any moment at time in life, that the world would be a happier place, a kinder place. So, Sherry, I feel so honored and so grateful to you. And I think at this point we'll end this part of the discussion, and we'll make a plan to come back and talk about the next phase of things.
Absolutely.
Wonderful.
I
Thank you.
thank you for having me.
Oh, I'm so grateful you came. Bye for now.
Goodbye.